So this is an illustration that we made recently. I just came back from Europe on another research trip showing ACTIVA being placed on a demineralized tooth rather. And again, this is an illustration. You're seeing the interface between ACTIVA and the tooth. And ACTIVA has a high concentration or a high energy level of calcium and phosphate, whereas the demineralized tooth, of course, has a lower concentration. But what's happening is because of the hydrophilic resin that ACTIVA has, the ions are able to diffuse with the tooth until equilibrium is reached. And once this equilibrium is reached and you find this balance, the tooth is satisfied. ACTIVA is not losing anything, it's just giving away what it has in excess. So what happens after that is nucleation sites are forming along the surface of ACTIVA, and the ions from the tooth will form on the nucleation sites of ACTIVA and start to mineralize into the tooth. And so it's different than bioglass that is precipitating these crystals. We're actually attracting the ions, the calcium and the phosphate ions from the tooth to ACTIVA, and those ions are what are forming the crystals. So in this case, many companies, we like to all talk like we're the answer. Here's what we did for the tooth. Well, really all we did was create these nucleation sites that invited the tooth to be a part of the process. So it can't be any more natural than that. And so back to the Franklin Garcia Godoy slide, exactly what you're seeing here is the ions that formed on the surface of ACTIVA are now crystallizing and forming the mineral elements.
I'm going to show a couple of clinical cases now. And again, the remarkable thing regarding the ACTIVA material is not only its ease of use and the number of years that I have been using it, it's what it does to help the tooth as we go forward. And again, sensitivity can be significantly reduced. This is a case that I saw back in February of this year, and as you can see, the composite is failing. And radiographically, I don't know what's going on interproximally there, but that certainly didn't look like a very successful restoration, and that tooth was bothering the patient. So we went ahead and we removed the restoration. I use Isolite as an isolation device in my practice, and I always pre-wedge as well to try to reduce the type of problems that you would have if you nicked the gingival tissue. So we removed a majority, if not all, of the underlying structure, got down there, and then I placed a new novel pulp protector that is going to be available sometime in the near future that contains calcium and phosphates and adheres to structure and is able to really release calcium and phosphates to help with pulp protection and pulp improvement and health as we go forward. And so the slide on the right shows that new novel material that we started using and testing at the office. And that is ACTIVA rebuilding that entire tooth structure on the left. And radiographically on the right, you see the ACTIVA material and that novel pulp protector underneath it. So you can see the radiopacity of this new material in conjunction with ACTIVA. So that was the immediate post-operative radiograph that was presented. He came back in a few months later for recare, and we took a secondary image just to see what was going on back. So after 5 months, the tooth itself is happy. There's no evidence of any radiolucencies, any kind of damage to the nerve or any kind of pulpitis going on. And you can see that after 5 months, this large restoration is still wearing very, very nicely.